The purpose of this video is to discuss the array of all of the symptoms making long COVID, discuss the different treatment options, and at the end bring my perspective from a naturopath view of how you could treat it holistically, because the internet is full of very mixed information and confusing information. But did you know that meta-analysis studies, so studying what's going on in the last 4 years with COVID, it's showing somewhere between 30 up to 47% of patients like you could be getting long COVID. So if you've had COVID, the chances are really high that you've got some level of the long COVID symptoms. Now, you may be minor or you may not know. Right up to you might have them all, and I'm going to get into all of those symptoms and how they intertwine, which is quite confusing for the patient. And so let's talk firstly of, I've made some notes on a whiteboard of all of the symptoms. So we've got fatigue. This is a really common one that patients talk about, fatigue. But if you've had COVID, fatigue comes along with that, but lingering with the long COVID. We've also got things like psychiatric issues. Now, comes with that is depression, anxiety, insomnia. And as I go on to explain, you'll see that they are intertwined, because if you're feeling tired, then there's a good chance that slowly but surely it wears you out. I understand if you're feeling depressed and patients are feeling down and confused about, why do I have this? We've got respiratory, so obviously shortness of breath or feeling a cough, still a cough lingering. We've got cardiovascular. There's so much with cardiovascular issues like myocarditis, just ongoing heart issues and clots and things. We've got gastrointestinal, the second brain. I have discussed in other videos about microbiome testing and the flora that make up that, but there's an interconnection between mood as well and immunity as well. We've got up here immunity, so it can progress into autoimmunity or chronic fatigue, because there's a component of chronic fatigue with just constantly feeling run down. We've got neurological, which is the brain fog and the loss of smell and the loss of taste, and they can just go and hinder. There's a lot more as well, little subtle symptoms like hair loss and skin conditions and rashes and POTS with posture raising with the blood pressure when you stand up. And there's a lot holistically to treat. But now coming into, let's talk about the treatment of long COVID. Now, you probably already searched a lot on the internet and YouTube videos, and there's kind of two bases. There's the one where there's the medical intervention, and they're using things which don't align with my belief of treatment and naturopathic philosophy, but they're using for neurological or for cardiovascular things like blood thinners or antidepressants, SSRIs, or they're treating pain with steroids. But then the other side is you may see videos on people have tried everything and nothing works. Now, I'm going to go in the middle, but going on trying everything, this is my real take-home message that I hope that I can share with this video, that you could understand that holistically, we want to try and target a main area for you. So it can be really frustrating, and I feel your frustration that you really want to get over this, and I can give you hope that there is light at the end of the tunnel. But if we can just pick out the most important thing, is it your insomnia? Is it your gastrointestinal? Is it your fatigue? And chipping away at it, because if we throw everything at it, and you certainly will read about the vitamins, the minerals, the hyperbaric chambers, the methylene blue, and if you just get everything and throw it at once, it's potentially the worst thing to do. Most patients can't handle that many things. It's better to pick a few keys and get guidance if you can, get someone with experience, do some tests, and then slowly work and chip away at the main thing. And once you start to see results, then you can feel an uplift of hope and symptoms and energy, and maybe neurologically you're feeling those symptoms improve, maybe getting your taste back, and you can sleep better.